Today, we are talking about something that's very common in newborns, something called neonatal jaundice. Almost 50 to 60% of term babies and 70 to 80% of preterm babies have jaundice during their neonatal period. In many communities, jaundice is surrounded by superstitions and traditional beliefs. But today, I'm going to share the truth based on medical facts so you can protect your baby and know when to get help. If you are a new parent or about to become one, this is important information you will want to know. Jaundice is when a baby's skin and eyes look yellow. It usually shows up in the first few days after the birth. It might look worrying, but in most cases, it's completely normal and goes away on its own. What causes jaundice? Jaundice happens because of a substance in the blood called bilirubin. When red blood cells of blood break down, bilirubin is released. The baby's liver processes this bilirubin and removes it from the body. But in newborns, the liver is still immature, so it takes a few days to catch up. As a result, bilirubin can build up under the skin and the skin looks yellow due to the color of bilirubin. Is the jaundice dangerous? In most cases, no. It's harmless and goes away within 1 to 2 weeks. But in some cases, if bilirubin levels get too high, which can be dangerous and even affect the baby's brain seriously, and the baby can have permanent brain damage. That's why it's important to check for signs early, follow your doctor's advice, and get the tests done if recommended. How can you help your baby? Jaundice in a newborn baby usually starts from the face and gradually progresses from the head towards foot in a stepwise manner. So if a baby is having yellowish discoloration at legs, it indicates higher jaundice than the baby having discoloration till chest or abdomen. Doctors may recommend treatment if the baby is having varied yellow color, especially in the first 24 hours. The yellowing spreads quickly, the baby is very sleepy or not feeding well. Tests show that bilirubin levels are too high and jaundice persisted for a longer duration and the baby had pale color stool or raised direct bilirubin. How is it treated? If treatment is needed, it's usually simple. The most common treatment is phototherapy, also known as light therapy. The baby is placed under a special blue light that helps break down the bilirubin to a more soluble substance which then gets out of the body through the urine. Phototherapy is not harmful. It's the best and safest way to treat serious jaundice. It usually takes 1 to 3 days depending on the severity of jaundice. Rarely, if jaundice is very high, other treatments may be needed like blood exchange or some medicines. In some conditions, the jaundice may be very high like blood group incompatibilities, G6PD enzyme deficiency, hypothyroidism, etc., for which some tests may be advised additionally. Let's talk about superstitions. In some places, people believe that jaundice is caused by evil's eyes or curses, touched by a spirit, or mother ate yellow foods during pregnancy, and keeping the baby under direct sunlight will remove jaundice. These beliefs are not true and can be dangerous sometimes. Jaundice is a medical condition, not a curse. Delaying treatment because of these beliefs can cause the baby to develop serious complications, including brain damage, hearing loss, or even sometimes death. I understand that traditions and beliefs are part of every culture, but when it comes to your baby's health, let's combine respect for tradition with trust in science. Happy parenting.